welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. Regarding the Jabalpur hospital fire case, 4 doctors have been booked under IPC section 304 for culpable homicide as hospital's fire NOC found expired. The preliminary probe into the Jabalpur New Life Hospital fire incident has revealed that the fire NOC had expired besides several shortcomings regarding fire safety, said the Madhya Pradesh Home Minister Narottam Mishra. Medical Dialogues team had earlier reported about the incident of a massive fire reported at New Life Multi-Speciality Hospital. At least 9 to 10 people had reported being killed in the incident. The fire possibly broke out due to a short circuit during the changeover of electricity supply from the generator after a power cut, informed the Jabalpur SP Siddharth Bahugana. He also said that police have registered a case of culpable homicide against 4 doctors cum owners of the hospital and arrested its manager and a doctor a day after the devastating blaze killed 8 persons, including 4 patients. Could death be treatable? A potential breakthrough as scientists revive cells and organs in dead pigs. Within minutes of the final heartbeat, a cascade of biochemical events triggered by lack of blood flow, oxygen, and nutrients begins to destroy body cells and organs. But a team of Yale scientists has found that the massive and permanent cellular failure does not have to happen so quickly. Using a new technology they developed that delivers a specially designed cell protective fluid to organs and tissues, the researchers restored blood circulation and other cellular function in pigs a full hour after their deaths. The report has been published in the edition of the journal Nature. Findings may help extend the health of human organs during surgery and expand availability of donor organs, the authors said. NMC issues revised guidelines for competency-based postgraduate training program for MD General Medicine. Through recent notification, the NMC has issued the revised guidelines for competency-based PG training program for MD General Medicine. These revised guidelines update the previous guidelines which were issued by the Apex Medical Regulator about a month back. The purpose of the PG education in general medicine is to create specialists who would provide appropriate health care to the community and advance the cause of science, research, training, and teaching the medical fraternity. For more details, you can check medicaldialogues.in. At GMCH 16 in Chandigarh, surgeons held guilty of medical negligence during Gall bladder operation. Dismissing the appeals made by the Superintendent of Government Multi-Speciality Hospital Sector 16 in Chandigarh and 2 surgeons of the hospital, the State Consumer Disputes Redressal Commission recently held them guilty of medical negligence while performing laparoscopic procedure for removing the gallbladder of a patient. It was alleged that the drain pipe inside the complainant's abdomen got fractured and the patient had to undergo a second surgery to removal of the same. Holding the doctors and GMCH 16 guilty, the State Consumer Court upheld the order of the District Commission and directed them to pay Rs 6.5 lakh to the complainant for negligence causing mental agony and litigation costs. Maximum 40-hour per week duty creche facilities at hospitals as Health Ministry releases draft guidelines for working conditions of nurses in hospitals. Concerned about the working conditions of all categories of nurses in healthcare establishments, institutions across the country, Union Ministry of Health and Family Welfare has released draft guidelines for governing working conditions of all categories of nurses in healthcare establishments and institutions. The draft guidelines have been released for comments from the general public and stakeholders. Comments may be furnished to nursing section via email within 30 days from the date of notification on the website of the Ministry of Health and Family Welfare. The guidelines deal with various aspects of the working conditions of the nursing professionals, including limiting their working hours to 40 hours per week and 8 hours per day. Further, the guidelines also require all healthcare establishments to provide restrooms for nurses on duty, creche facilities, locker rooms. To check all the guidelines in detail, you can check medicaldialogues.in. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.